Hello, Andrew Kolsky with Stop My OCD. And today we're going to be talking about a study related to repetitive negative thinking during OCD exposures. This is a study done by the authors Kelly, Nota, Potluri, and Krompinger. Let's get into it. Repetitive negative thinking. So what is repetitive negative thinking? In the study, they define it as a thinking style that involves perseverative engagement with negatively valenced private experiences. I like to kind of convert a lot of this stuff into what I call English that I can understand. So I'm going to share with you my thoughts on it. And in English, it means worry and rumination. And the purpose that we worry and ruminate is to avoid unwanted inner experiences. So the study defines worry as a chain of thoughts and images that are affect-laden and relatively uncontrollable, and is often reported to function as a means of problem solving, coping with distress, or creating motivation. In English that I can understand, it means worry involves thinking about potential future problems, uncertainties, or threats, often accompanied by feelings of anxiety, fear, and nervousness. Worrying can be productive if it leads to problem solving and taking actions to reduce or avoid the potential negative outcomes. However, excessive or chronic worry can interfere with daily functioning and lead to physical symptoms such as headaches, insomnia, and muscle tension. So worry is future focused. It uses the words that OCD loves to use: could, may, might, it's possible. Those are all OCD types of words. So why do we worry? Well, it's more comfortable to engage in cyclical, repetitive inner dialogue around what if something bad happens to my child than it is to sit with the thought that something bad may happen to my child. Well, what about rumination? How's that different? Well, the study defines rumination as repetitive and passive focus on causes and consequences of symptoms and can be deployed as a means to gain understanding of or justification for current feelings of distress, a negative reinforcement cycle. It serves an avoidant function. Individuals with positive beliefs about rumination report feeling they are gaining insight into their symptoms, feelings, and problems. And rumination can serve to build the case that a sufferer's situation is hopeless. I've thought about it every which way, and there's no answer. This can stem the tide of guilt and shame by justifying depressive behaviors such as withdrawal and isolation. In English, rumination refers to a repetitive, passive, and self-focused thinking pattern where one dwells on past events or experiences and repeatedly goes over them in their mind, often in a negative way. It involves analyzing and reflecting on the same thoughts, feelings, and memories without reaching any resolution or gaining any new insights. Rumination can lead to feelings of helplessness, hopelessness, and depression. So rumination is about the past. It involves reflection on past events with a desire to understand them, but without resolution, therefore keeping us in a state of doubt. Sounds very much like OCD, right? That state of doubt. So why do we ruminate? Well, we try to make sense of difficult experiences. When people experience a distressing or traumatic event, they may ruminate as a way of trying to make sense of what happened, process their emotions, and find meaning or closure. For self-reflection, some people ruminate as a way of reflecting on their own thoughts, feelings, and behaviors, and gain a deeper understanding of themselves. Perfectionism. People who hold themselves to high standards may ruminate as a way of viewing past mistakes and failures in order to avoid making the same mistakes in the future. From an anxiety and depression perspective, rumination is a common symptom of anxiety and depression and can exacerbate these conditions by reinforcing negative thoughts and emotions. Lack of distraction. When people are bored or have little to occupy their minds, they may start to ruminate as a way of filling the mental void. So it's important to note that while some rumination can be helpful and lead to insights and growth, excessive or repetitive rumination can be harmful and lead to negative outcomes such as worsening mental health symptoms, decreased productivity, and decreased quality of life. Worry and rumination are used to avoid unwanted inner experiences. This is a compulsion. We're trying to avoid the feelings that we have. In OCD, high worriers experienced a greater degree of intrusive thoughts, provided they were also high on obsessive beliefs such as perfectionism, intolerance of uncertainty, and overestimation of threat. So what's the role of repetitive negative thinking in ERP, which is exposure and response prevention? Well, active engagement in ruminative responses to traumatic memories, including persistent attempts to understand the trauma, were thought to interfere with exposure and response prevention. Rumination proves to us that we are truly stuck since we can't find an answer. And worry keeps us from actually focusing on or accepting the uncertainty. The conclusion in the study is that repetitive negative thinking related to ERP for OCD accounts for variability in OCD symptoms and treatment outcome over and above existing measures of RNT. Treatment approaches that incorporate interventions targeting RNT directly may unlock the potential for ERP for those who have not benefited, furthering the reach of ERP. In English, worry and rumination are compulsions that need to be addressed in the ERP treatment process. So taking a look at our chart here of the OCD treatment process, you'll notice in the green box, we're looking at the OCD cycle. The OCD cycle is obsessive doubt leading to consequences about those doubts, which leads the person to feel distress. And as a result of this, the distress, they do compulsions to reduce their distress. So you see the blue arrow there says the worry and rumination focuses on that compulsion part, and that's something that could interfere with treatment if the person is heavily focused upon it. So that's where that fits into the OCD cycle. And at Stop My OCD, you can visit us at our website, stopmyocd.com. You'll find all of the videos we have about OCD. You can join our OCD support group. We've got other resources and OCD treatment information. So thank you for watching this video. We try and bring you the up-to-date science on what's going on in the world of OCD. And I appreciate you watching, and I hope you watch some of our other videos and educate yourself about how to deal with OCD. Thank you.